MSF's priority right now is to protect our staff, to maintain the operations where there's not much transmission yet, but to be able to respond, to make sure that we are able to support local authorities to carry out social measures to prevent this epidemic spreading further, but also to be able to treat patients. The situation in Europe is very challenging at the moment, and certainly the health system is under a lot of stress, particularly in France, Italy, but increasingly in other countries as well. Our major concerns are firstly to protect our staff, because we cannot respond if our staff are not safe. Secondly, we want to support the authorities in all the places we work to carry out the important measures of social distancing, that is keeping people safely apart so that we can prevent the spread of this virus. And then thirdly, it's really important that we have the capacity to respond and to look after people and to be able to treat them. The last thing is we realise that there's a lot of social and economic consequences of this crisis which are unfolding, and that is something that concerns us as well. In MSF, we work in many places where the health system is very fragile, where there already are not enough staff, enough resources, where people often have problems of access, particularly where there's conflicts or crises like Afghanistan, like Iran, like much of the Middle East, like Burkina Faso. So these are places where we're really trying very hard to ensure that our operations can keep going to treat the diseases that are already killing people, but also that we can help the response in those countries. There are a number of big challenges for us. Firstly, the travel restrictions mean that the way we normally operate, sending international staff all around the world, is very difficult. The second thing is that the supply chain is really problematic, particularly for things like masks, gowns, gloves and other important equipment such as oxygen concentrators. This means that we are asking people to be really sensible about the use of protective gear. We really need to save those for our health staff when they really need them. We are working on all the possible supply options with the supply centres in Europe, and we're also asking each mission to look at options for local or regional purchase, because we know that this is going to be a big problem for the coming months. When you think about the communities that we work with anywhere in the world, there are people with particular vulnerabilities to this virus, and that is obviously people with medical conditions, but also just by the nature of the context we work, people are very vulnerable because they often don't have good access to care, because they may be affected economically in a very severe way by this crisis. One of the populations we need to think about in particular is people who live in close proximity to each other, and that includes places like refugee camps. Obviously it also applies to many of the big urban areas that we work in. MSF is already supporting in Italy a hospital and has some other projects in development. We are looking at trying to mount a project in Iran, where obviously there's a sizable number of cases now. We are also supporting the authorities in Afghanistan based around our project in Herat, which is very close to the Iranian border. At this point, we're trying to ensure that there's good preparation, that we're part of the overall approach to this epidemic, and that we ensure the protection of our staff.